Let's start recording. Yeah, perfect. That started recording now, so that's great. So first of all, welcome to the first drop-in open house surgery for January 2024. Hope you've all had a lovely Christmas and New Year. Seems a bit a long time ago, to be fair, but it was only a couple of weeks ago, which is odd. So I'm really delighted that we're joined by Zeenat and Yusra today to talk about the significant changes happening within foundation pre-reg oral submission. And I know that they're both going to be here to talk about that. So I'll pass over to them shortly. I've got a couple of slides as well, mainly around just updates around Pharmacy First and other bits and bobs that I feel that contractors will find useful, and also some of our pharmacy teams as well. But if I can come to the and yes, sir, I'm just going to come through to your slides, and I've actually embedded it into my own slide. So bear with me while I just bring that up. And then if you want to just let me know when you guys are ready, I can turn the slide for you if that's okay. But does that work for you?
Yep,
yeah,
perfect.
Okay, lovely. So, Yusra, do you want to just introduce yourselves, and I'll hand over to you. So thank you.
Sure. Thank you so much, Rajshri, and thank you for inviting us today. So hi, everybody. My name is Zeenat. I'm the training program facilitator for the Midlands Foundation Pharmacy team. And basically, we've got a team of 8 facilitators, and we each cover different ICSs and regions. So the region that I cover is LLR, so Leicester, Leicestershire and Rutland. And what we're doing at the moment is trying to communicate with employers such as yourselves in community pharmacy as well as other sectors about the changes to the foundation training program, and specifically what you need to do in the immediate future in order to be ready for 25-26, which is when this sort of big change is happening. So I was going to run through this presentation, but I have this really annoying cough, and to save me from annoying you guys with that cough, I've roped Yusra in to run through the slides, and then there will be an opportunity for you to ask questions and sort of, have a discussion. A few caveats. This is going to signal a lot of changes, and I can completely appreciate how busy you and your employees are within the community pharmacy sector at the moment, and especially with Pharmacy First, etc. I can appreciate how much pressure you're under, and us coming on here and being like, but you also need to do this isn't ideal. So don't shoot the messengers, because we didn't plan this. So we want the sort of masterminds behind this, but we are communicating it out to yourselves. So that was just sort of my little disclaimer. A couple of other disclaimers is we have different teams working on different things within our wider pharmacy team. So you may have some questions that me and Yusra don't have immediate answers for right now, but we can definitely go in, ask the right people, and then communicate that to Rajshri to cascade with yourselves. And similarly, sorry, it is quite a changing landscape. So there's a lot of information that's emerging quite sort of abruptly and very, very quickly. So there may be some things that aren't 100% clear right now, but they are sort of being worked on in the background with our national team, etc. So as soon as that information does sort of become available, that's usually cascaded to the LLR faculty, which includes Rajshri, and hopefully she can cascade that information to yourselves. So that's my little intro. I'm going to sort of go on mute and try and cough away while handing over to Yusra to introduce herself. So thank you.
Thanks, C. Okay, can everyone hear me? I hope so. Okay, perfect. I'm going to basically just run through some slides like C was saying. So Rajshri, if you can just go to the introduction slide, just go one back so we can start off. Yeah, perfect. So I thought I'd go through IETP, what that means. So that basically stands for Initial Education and Training of Pharmacists. So I'm going to be referring a lot to that. So that's why I wanted to go back to that slide. So thank you for that, Rajshri, if you can move on. Okay, so in 25-26, which is the upcoming foundation training year, there's going to be a lot of changes that are afoot. So NHS England basically is going to be the delegated responsible statutory educational body. So what this means is that we have the quality assurance management of full foundation trainees across England, and that the full new learning outcomes are going to be used, because at the minute it's just the interim learning outcomes. All trainee pharmacists are going to need to be recruited through ORIAL. So what ORIAL is It's just a portal in which we basically allow the National Recruitment Scheme to open. So I don't know if everyone's heard of Ariel. There's not going to be any approval of training sites outside of this process, and no eligibility for mechanism of payment outside of that. There is going to be harmonisation of funding across all sectors. So all sectors, regardless of where they are going to get £26,500, and all trainees graduating from the new learning outcomes are going to be assessed against the new learning outcomes within their training year, which is going to be independent prescribing based as well. So there are going to be some people that haven't actually done their training through the new learning outcomes, and they're going to be doing their training year in 25-26 against the old learning outcomes, which is absolutely fine, but they won't be able to be an independent prescriber at first registration. So those are just basically the key facts. Registry, if you can move on, please. Okay, so we're going to basically talk about the recruitment scheme. So if you move on to the next slide. Has that moved on? Okay. So the employers, in terms of the supervision and assessment of the of Ariel, they're going to be need to have to confirm three things. So prescribing learning environment, designated supervisor, which is basically the new term for a tutor, and designated prescribing practitioner. So you're going to need to basically agree to the fact that there's going to be a prescribing learning environment, a designated supervisor, and a designated prescribing practitioner. At this point, you don't need to basically say who that designated prescribing practitioner is or where that prescribing learning environment is. So the Ariel window has basically opened for you to put everything onto Ariel from like the 11th of January. And it will shut on the 1st of March, but I'll go through that with you in a minute as well. All training sites would need to use the assessment strategy and the e-portfolio framework as well, which includes all the assessment activities that relate to prescribing as well. So all of this is going to be accredited by the GPHC as per, but we are going to be the statutory educational body. Can you move on to the next slide, please? So we just thought it'd be a really good idea to give you some kind of links in order to get you, make you au fait with exactly what the process is. So you have to register each year through Ariel. Anything outside of Ariel will not be quality assured or managed. Provide specific information as part of that process and agree to meet the terms of participation through that scheme as well, which I've already gone through. I think it's a really good idea to go through all these resources. I think Registry is going to share all the slides with you guys anyway, so there's no need to worry about that. But I think just spend some time having like a read of that and just having a look at the information. It would really be useful. I will get through to that as well with your Registry. That's going to be answered in a second. Can you move on to the next slide for me, please? Okay, in terms of the timeline for the recruitment, so what, if anything, what we want you to take from today is that the actual window for putting your training site onto Ariel go through to Ariel and pop on your training site if you wanted a trainee in 25 onwards. Okay, so you've got till now to the 1st of March to be able to do that, but you need to basically agree to the terms of participation, DPP, and a prescribing learning environment. So basically that means at this point you don't need to specify who the DPP is or where that prescribing who that DPP is or where that prescribing learning environment is, but you do need to basically identify where the rotational site is if there's a multi-sector rotation. In June to October, there's that the applicants will be able to apply and preference. In September to October, that's when they will be doing their assessments, and then from December, that's when they will get allocated. So that's when we will be able to kind of contact them, and then hopefully in July to August 2025, that's when they will start. So that's the timeline basically. If you move on for me, Registry, that would be amazing. Thank you very much. Okay, so just some quick information about multi-sector rotations. So the take-home point for this is what we mean by a multi-sector rotation. So it's defined as a 13-week or a 26-week rotation in another sector of practice. This isn't going to be mandatory in 25-26 year, but it's going to be mandated in 26-27 onwards. So the recognized sectors of practice are the managed sector, which includes trusts and mental health trusts, community pharmacy, and general practice, including health and justice. So where a multi-sector rotation is included, we require one lead employer to be identified. So for example, if you've got a community pharmacy and you've got 13 weeks with general practice, you need to also just have one of them as identified as the lead employer. So for programs including multi-sector rotations, they need to be located reasonably close to each other, and you also need to actually provide some information into lack of, or if there are any transport links for public transport. Within this, you cannot stipulate that there needs to be a requirement that the trainee has a car, just for equity purposes. So that's something you guys need to be aware of. If you just move on for me, Rajshri. Okay, so I know I've just spoken a lot about Oriel, and a lot of people might not know what Oriel is, so we do some drop-ins. We are going to be running them through January and February. I think the links are going to be shared with you anyway because they're in the slides, but they mainly run through lunch times and in the evening time, so if you needed to just have a read of that and just kind of get to grips with it if there's any questions about Oriel. Thank you. Rajshri, if you just move on to the next slide, and the next slide after that. So we're just going to be talking about DPPs and the prescribing settings and the practicalities of that. So if you move on to the next slide for me. Amazing. Okay. So in terms of DPP access, I know that can be a little bit terrifying at this point because the lack thereof. But that's where multi-sector rotations will come in. Obviously, there's not a stipulation for multi-sector rotation in 25-26, but there will be. If you kind of start building those relationships now, it will support the access to a DPP and a prescribing environment. We don't need to know at this point who the DPP is, but we will need to know once your trainee pharmacy starts in July 2025. So at that point, you need to tell us who it is and whether they meet the person specification, which we'll go through in a minute. They also need to be able to kind of supervise against a nominated clinical area and upload that information onto the e-portfolio. There needs to be 90 hours of practice as well, which needs to be supervised. So the DPP needs to have overall oversight of that. And then there is going to be assessment of that via prescribing assessment activities, which are going to be uploaded onto the e-portfolio as well. So that is it in a basic nutshell. We will give more information about that as time goes on. If you move on for me, Rajshri, that would be great. Thank you very much. Okay. So just some information about the DPP. So the trainee pharmacist within that year and onwards must have a DPP. The DPP can be the same person as the designated supervisor or completely separate person as well, okay? They don't need to be in their primary training site. So it doesn't need to be, if the primary training site is going to be the community, it doesn't need to be within that setting. They can be elsewhere. They can supervise multiple trainees at one point, but it is based on whether they've got enough time to be able to supervise as well. So taking that into consideration. There is a stipulation that they don't need to meet that 3 years experience frame element, which was part of that RPS DPP competency framework, but we have linked the actual specification onto the slide as well. So I think it'll be good for you guys to have a read of that as well. If you move on for me, Rajshri, that would be great. Thank you. So just a little bit of information about the nominated clinical area. So in terms of what the nominated clinical area is, it's basically where they are going to do their prescribing assessment activities. It doesn't necessarily need to be the area of prescribing for the DPP, but they have to have appropriate experience to be able to supervise them. The normally, if the DS and the DPP are two different people, they normally need to come to an agreement within the nominated clinical area. We as NHS England aren't going to stipulate exactly what the clinical area is going to be. There's not going to be a definitive list, but you do need to take into consideration that the trainee pharmacist has access to patients within that clinical area, so they can basically get all their prescribing done within that setting. And then all that information and evidence basically will get put onto the e-portfolio and help the DPP to decide whether they are satisfactory and to be signed off basically on those activities. So that's that in a nutshell. If we move on to the assessment bit, Rajshri, that would be great. Thank you. Okay, so what we mean by prescribing assessment activities, they basically form a little bit of the assessment strategy, which is something that will go into their e-portfolio, and basically they will then be able to map those to learning outcomes. So in terms of that, the DPP will have the final responsibility to say whether that they have satisfactorily completed that. If the DPP at any point feels like, okay, I don't think that that was to a satisfactory standard, they can get them to repeat it. We will be able to give like the supervised learning event forms to be able to structure that assessment as well. But the main responsibility falls onto the DPP to make sure that they're working against the competencies provided by the RPS in their framework as well. So it's just to get a holistic sense of making sure that they can be signed off on those learning outcomes. If you can move on for me, please, Rajshri. Thank you very much. Okay, so considering that the DS and the DPP are two separate people, they've got two different sets of responsibilities. So just keep in mind that the DS is responsible for the final sign-off and basically signing them off against all of the learning outcomes, and which also includes the prescribing assessment activities. They also need to confirm that the DPP has determined that they have satisfactorily completed the prescribing assessment activities, have adhered to the RPS competency framework, and the 90 hours have been completed as well. The DPP themselves are basically in charge of making sure that the prescribing assessment activities have been satisfactorily completed, that the RPS prescribing competencies have been demonstrated, and that they have had oversight of the 90 hours. I'll go through this in more detail, but obviously all of this will be accredited and approved by the GPHC as well. So if we move on to the next slide, that would be great. Thank you very much. Okay, so in terms of supervision, the DPP does not need to directly supervise all of the 90 hours. They just need to be able to make sure that they've had oversight of those 90 hours. So technically they can kind of delegate some of that learning supervision to other members who are appropriately trained within the healthcare team. So in terms of that, they can spend some time with them outside of that prescribing environment. So if there's skills that they need to work on in terms of history taking, physical and clinical examination skills, all of that can be done within those 90 hours, but they don't necessarily need to sit with that trainee for 90 hours. Okay, the final responsibility of that supervision is with the DPP. In terms of the 90 hours, there's no like stipulation on how we want you guys to do it. It doesn't need to be in a block of time. We have put some models forward that you can use if you wanted to. So for example, they can do half a day over a period of 5 weeks, or they can do like a day a week for about 13 weeks, which would also align to that 13-week cross-sector rotation, which might work well. But it is totally up to you. You guys are autonomous with that as well. So that's So in terms of training, so we are going to put some training out there, so don't worry about that. to be a DPP and DS, obviously there are the experiences needed, obviously, but you get that as you go. It is a generic transferable set of skills and knowledge. There is a variety of training resources available. We have linked that as well, and there is a training offer available at the minute as well. So all that will be within the slides. Going forward, we are going to provide clear materials for DPPs and DSs on how to use the assessment strategy, which is going to be a core component of that year and going forward. So familiarise yourself with what the assessment strategy is, what it entails, the e-portfolio. There are drop-ins that are available throughout the year as well, so it should help you. We're not leaving you in the lurch. What the respective roles and responsibilities of the DPP are and how they differ from the DS if they're two different people. If you move on. Thank you very much. Okay, so we also do have some sessions coming up for just going through the webinars for IETP reform. So obviously I know I've given you a lot of information and there are a lot of resources to digest. So once you've had a read, you might have some questions about that. That's absolutely fine. Across January and February, we have them in the evening time around 7:30, 8 o'clock. So if you have any questions, please feel free to pop on them and we can answer them and hopefully help you out a little bit. If you move on to the next. Okay, so these are just some more resources. I know there's loads of reading for you guys to do, but try to get your head around it, basically. So in terms of keeping up to date with all the initial education and training of pharmacists, there are newsletters that are available so you can basically sign up to them for any new updates. Engage with the assessment strategy and the e-portfolio. It's going to be a very important aspect of the training year. So trying to get your head around what the assessment strategy is, what the e-portfolio is, how they work, those kind of things is going to be really imperative. And the earlier you do it, the better it is. Bookmark that Oriel site. So you need to start thinking now about putting all of your training sites on Oriel. That is the website. Any queries throughout the year at any point, that is the email address that you need to basically drop us a message on. And hopefully someone will get back to you in a timely manner. But I think that is me for now. Any questions?
Thank you so much, Yusra. I completely appreciate that was really quick. There's a lot of information to take in. I would say the key priority at the moment is focusing on Oriel, just because you do have quite a tight deadline to get the programs entered on. So even things like the assessment strategy, all of that can be looked at a bit later, but Oriel is definitely the thing to focus on at the moment, because you have until the end of 1st of March, essentially, to get your programs ready, so that we can data cleanse that from our end and then have trainees hopefully select your pharmacy as a place that they'd like to complete their foundation training in 25-26. There's been some questions that have been coming through and I've been trying to answer them in the chat, but if anyone wants me to elaborate on any of the points or have any further questions, by all means, feel free to ask away.
Thank you, Zina. Thank you, Yusra, for that. I put a few questions. I don't know if anybody has any questions or wants to raise their hand or just come on in, because there's not really many of you on here. But are there any specific questions? And I know there was one question around, is this an LLR specific thing? But just to reiterate, this is a national, this is happening everywhere across England, and the deadlines are exactly the same. So all contractors, all pharmacies will need to make sure that they submit their submissions via Oriel by the 1st of March. In order to take on students 25-26. And if that deadline's missed, like Zee just mentioned in the chat, then there is no lagging period. It's gone, the deadline's missed. There will be no mop-up. So therefore, it's really important that this is done by the 1st of March. I can't see any questions.
I think Christian's got his hand up.
Oh, Chris, sorry, coming in.
Yeah, hi, just a quick one. Why is the deadline so short? Has this been open for quite some time?
So it hasn't been open for quite some time. It's the deadlines weren't. We knew that this would be the period. So we knew that it was going to be between January and March in 2024 because Oriel has like an 18-month cycle, and it always has, because we've been running Oriel for years. It's just not been mandated that everyone uses it. And because there's quite a lot of things that need to happen in the background, so we need to get employees to put the details on, then we need to data cleanse all of that to make sure it's appropriate. We need to put that on the website. Trainees then need to sort of work in the background and complete some assessments and preference which training sites they'd like to go to. So there's a lot to be done, which is why it's so early on. But in terms of the deadline, the dates weren't made clear. We knew it'd be around this time. I genuinely thought it was going to be till the end of March. So I had that sort of perception. But actually, when the dates were finalized, it was the 1st of March. And I was like, oh dear, like that's even more of a time crunch. So I appreciate it's not ideal, but it gives us a clear idea
Not at
for.
all. It's not smart. Who makes those deadlines? Is there somebody specific, or is it a joint thing?
It's done nationally, so there's a national work stream on the Oriel recruitment, and that's essentially where these deadlines and information come from.
Just on that,
Alright,
Kish,
thank you.
just on that, Kish, as well, it is something when I found out, it is something that myself and the workforce group did. So I work with the workforce group, which is basically working with UHL, LPT, ICB, and when we were made aware of the deadline, that was basically our concern. It just seems that this is going to get diluted amongst everything else with Pharmacy First and everything else that's going on. But there's been no.
I know.
No, but it's ridiculous to think that you could. It's ridiculous to think that you can actually squeeze that in amongst the hundreds of pages of reading we already have to do, in the communities. That's mad.
I know that our training program director in the Midlands, she has been really lobbying for an extension on this. So if anything comes out of that, I will genuinely be letting you guys know, and you'll be the first to know if there is an extension on that. But at the moment, it does stand as 1st March, and that's why I appreciate that there are so many resources about the DPP and all of that stuff. While that is important and it does need to be digested, actually anything related to Oriel should be the priority, because you can have a look at that stuff after your program's on Oriel. And despite it seeming like a very lengthy process, it is a form that needs to be filled in, and it is one form. It's actually working your way through that form, and it's like providing information about your pharmacy, about your program. That should definitely be the priority, because once you do that, then you don't have that 1st March deadline breathing down your back, and you can digest everything else following on from that. So if I were in your position, that's what I would tackle first.
All right, thank you. Thanks.
Just on the back of that as well, I guess, and I've spoken to Zee on numerous occasions now, so I've kind of vented a lot of this already onto Zee, so hence why I'm a little bit calmer now. But she has had the brunt of it, unfortunately. But she is the messenger. But at the same time, I think it's important because from an LPC perspective, my concern also, as well as what you've echoed there, Chris, is also the fact that because there's obviously this requirement to be DS and DPP, a lot of our contractors will miss out because it's labour intensive as well, or it's seen as labour intensive. So there's a real risk here that we have less foundation and that succession planning in terms of future proofing our workforce going forward, because there's a lot of work involved just to get us up and ready to be in a fit state to take on the foundation. So that's a real risk, not just for LLR, but it's a risk that other LPCs have echoed as well. And obviously, trusts have their own concerns on that. I mean, including costs as well. But that is a real a very valid risk at the same time. Just one question from me, Yusra and Zee, just for our contractors that are here today. Can you just kind of give us a guide? I know you've given us the links, which I've already shared on our website, which I've shared the link at the outset of Yusra's presentation. But how long does the Oriel process take from start to finish? Is it something that the contractors can do in one sitting once they've got all the information, or is it something that they'd have to go back and forth? And just from a time perspective, how much time do they need to protect?
So let me see if I can actually just show you, because that might just be easier. So let me just bring it up. Give me 1 second.
Thank you. Because I think a lot of our guys here probably haven't seen Oriel, may not see it, so
it does sound a lot more intimidating than it is. It's basically a website. So that's the first thing to know. There's no separate program or anything like that. And it's this He Lays website, and the main thing to do at this point is register your program. So that means, what pharmacy is it? Are there any rotations? You know, how big is it? What's the description of it? Like, what makes it attractive to trainees so that they preference your pharmacy above others? So the program description is quite important, because you want to make it attractive so that people actually sort of select that, yes, this is the pharmacy that I want to do my registration year at. So you basically need to fill in this employer program information registration form. And it's something that you would submit and the following form in full to register. I would think it can be done in one sitting, because it is a bunch of fields, but actually nothing that theoretically you wouldn't already know. So your program, sorry, I knew that was going to happen. So your program description, this is where I sort of said you need to make your program attractive. And there is an employer handbook that literally goes through each of the fields. So it gives you some information about how to make a program a bit more attractive. The number of places that you'll be offering. So, for example, if you're sort of going back and forth between, we can maybe take on 3 trainees, or we can take on 2, put 3 down, and then if you need to reduce it to 2, tell us, and we can reduce the number. So there's some flexibility with changing the number of places. There just isn't flexibility with adding programs on. The start date, it's an indicative date, so approximately, when it would be, but we anticipate around that July, August period. About skilled work visa, about the number of hours. Now, training provider, multiple rotations, and then your contact details. So, for example, if there is something that we're not sure about, we have a query, when we do the data cleansing side of things, we can then get in touch with you and be like, hold on a second, you submitted this program, we've got a few sort of questions, can we clarify? And then this is the part where the terms of participation do need to be read and agreed to. Tick all of these boxes and submit. So as a form itself, it's nothing super intense. It just means that there is some reading that goes alongside of it to make sure that actually what you're filling in is what's going to give you the best chance possible of getting a good quality trainee. I hope that adds some clarity.
Yeah, it does. Thank you, Zee. Kish, do you want to come back in?
Yeah, just a quick question on students that require visas. Is there a policy in place, or has it changed since we've left the EU, or is there anything, rules and regulations surrounding having students from abroad?
I'm going to be honest and say I personally have no idea. So in regards to skilled visa worker entry criteria, I don't think there is a requirement that you need to offer it. Well, I know there is a requirement that you don't have to offer skilled worker visa sponsorship. But if you do, then there will be some extra information, and there is a visa sponsorship employees website that's linked on Oriel, so it's worth giving that a read, but I personally don't know much about that. Sorry.
That's all right, thanks.
Okay. Thank you. Any last questions or comments for Yusra and Zee? Because it's quite important, this is, and I feel that many of our contractors may miss the deadline, but we really need to get the word out, and I felt it was really important that Zee and Yusra joined us today, it being February. There's lots of information. Appreciate that you, like Zee said at the outset, there's a lot of information for you guys to digest. There's lots of information on the website as well, which kind of complements and mimics already what's out there in terms of what NHSE have done as well. But if I can't see any additional hands or any questions, though, shall I put that to? Oh, go on, Zee.
What I'll do is, considering I'm sort of the training program facilitator for LLR, I will pop my email address in the chat. So if there are any sort of specific foundation-related questions, feel free to reach out to me, and I can try and support you where I can with getting those programs ready for 25-26.
That's brilliant. Well, thank you very much for joining. Feel free to carry on and stay with us. It'd be great to have you. And there might be some more questions in the chat, I'm not sure, but feel free to stay with us if you would like. So guys, I'm going to move on whilst I just get my bearings with my slides. I need to go back to the original, and I'm sure there's an easier way to do this, but I don't know that easier way, so you're going to have to watch me just scroll frantically through my 40 odd slides, and I'm not sure if we'll have the opportunity to go through all this, but I'll do my best to whiz through. So you should already be able now to, thanks Zee put her contact details in the chat. Guys, I don't really have long. I mean, we're due to close at 9, but I'll do my best to work through and give you plenty of opportunity to make this interactive and ask, considering there's a lot going on, particularly around Pharmacy First as well. So As always, there's a lot of social media WhatsApp groups that we've got set up, including emails. And over the last couple of weeks or last week, following on from my Pharmacy First email, I think there was a flurry of new emails that were added to our mailing list. And just to reiterate, we would only naturally have your ODS pharmacy email. We wouldn't necessarily have your personal NHS mail address. That's not something that's given to us. Because obviously some people work across borders as well. So if you're not receiving any of our mailing, if you're not on our mailing list, not receiving our emails or not part of our WhatsApp group, please do get in touch, pop it in the chat or let me know, and I'll be happy to add you in any shape or form. So today, I mean, we're going a bit backwards because we've already heard from Dee and Yusra in terms of the changes to Foundation, but I want to give you a quick update in terms of what's going on within LLR, mainly around Pharmacy First, and give you an update around price concessions as well. But before I do that, I'm going to move on really quickly to the ICB update. And I hope, sure you guys, can you all see that in terms of the LLR ICB update? So this is taken from an extract. So a couple of months ago, I was informed by ICB that there's some switching exercise that's already started to take place over the course of 2023 and 2024. And I want to make you guys aware today and continue to kind of beat the drum on this, because this will obviously affect you in terms of your stock holding and why things were prescribed and no longer prescribed as well. That full list is now available on our website, and the link is there in this presentation will be shared with you via our website, and we'll share the link shortly as well by the end of the week. But there's the list of prescribing switching work that's being actively undertaken by the ICB, and it's a couple of pages long, so it's really worth having a look at that to support you with regard to making sure that you're not going to be any further out of pocket as well. And I'll come to out of pocket and price concessions as well shortly, but I just wanted to reiterate that that list is available on our website, so you can download and access that anytime. In addition, the ICB have also formulated a teaching forum. Again, I mentioned this last month or back in November, actually, because we didn't have the open house surgery in December. This is an LLR teaching forum for all pharmacy professionals across the region to come together and learn about one another's topics, work, what's going on within their work setting. So, for example, UHL has spoken about some things that they've been doing from an ICB perspective. We've been talking about some of the prescription switching, but other aspects as well. But it just gives you a good feel and a flavour of what's happening outside of community pharmacy, but how community pharmacy plays a significant cog in that primary care, and it's about working together. So although sometimes there is a segment around community pharmacy, it may not necessarily be about community pharmacy, but it's all about primary care and secondary care coming together and what's going on in each of those as well. Okay. I'll come to the chat in a minute. I can't do both things, so I'll come back to that in a minute. So in terms of Pharmacy First, and I'm really struggling to see these slides now because they're so small for me because I'm sharing my screen with you. So this is I've taken this actual slide from the original email that I sent and I circulated to all our contractors last week. But really, I wanted to reiterate that if you haven't had the email or not aware of what to do or where to start when it comes to Pharmacy First, although we've got significant registration numbers, we know that around 91% of LLR contractors are now registered for Pharmacy First, and the regional average for Midlands is at 89%. We're doing great, but it just helps, hopefully, in a sequential manner and a sequential order to allow you to understand what you need to do step by step and not become too overwhelmed as well. So the slides are there. I'm not going to go through each of the steps. We've obviously got this Sunday, we've commissioned an additional CPPE webinar for ENT skills assessment, and we did that on our own back. We felt it was the right thing to do for our LLR contractors, considering there was very scarcity around available spaces and also geographical challenges as well. So we really specifically wanted to have something within LLR as well. So we've been able to commission that and provide additional 120 spaces for our LLR pharmacists as well. So that's been great, and myself and Kate will be there on the Sunday as well. So if you've registered, great to see you. So there's a lot of information that you need to work through. I think, just to tease out a couple of points is really around, it's not just CPPE training that's available. There's a wealth of training out there now, and I'm sure you guys have been bombarded with what training is available out there. But but there's also clinical skills as well. So one question that I had from a couple of contractors who are already doing the extended care service, including the otoscope, so part of tier 3, is, do I need to retrain? Do I need to do the CPPE ENT training? And that's been a question that's been coming up to me. And the answer is no, you don't. It's really about making sure that you do your self-assessment framework through the CPPE website, and then obviously then, based on your competency and you assessing your own personal competency, you'll identify the gaps, and you can obviously work on those gaps. But if you identify that there's no gaps, then that's absolutely fine, you're competent. So there's no need to reaccredit or redo if you've already done that. And it could be that, so one contractor wasn't sure about the otoscope and suggested that actually they could go onto the clinical skills website and revisit the otoscope recording on the clinical skills website to ensure that they're kind of retrained, reaccredited, or just feeling a bit more competent on that area, if that's the one area that they feel they're lacking as well. So, we've heard a lot about service specification and the clinical pathways. I'm going to come to that shortly as well, in terms of making sure that you're not using the draft clinical pathways, you're using the final published ones, and that's what you're signing. So just keep that at the back of your head. And remember to sign up via NYS as well. So obviously, those owners or pharmacies that are already providing CPCS and also wanting now to provide Pharmacy First need to re-register on NYS as well. So there's no rollover, there's no automatic, because you're doing CPCS, there's no need to do that. You have to. Okay, I've had a number of questions, and I'm sure Gareth and the team have also had that around otoscopes, wanting to know a specific brand. Unfortunately, there is no gold brand or gold standard with this. Again, just have to have a look at Annex C and make sure what you're purchasing is fit for purpose and correlates to that as well. And obviously, if you're members of different groups, you'll be able to hopefully acquire some discounts as well, whether that be through MPA, Newmark, whoever you're with in that regard. So just going forward, this again a little bit taken out from that email that I circulated. There's also aspects around IT systems. Continue to check on the service specification on that in Annex B, and there's additional information coming out on the CPE website as well. So we've got a holding page for that, but also some local information. But then it diverts you back to CPE on that. Other aspects which I felt were really important was just around the team briefing, making sure that you're not kind of don't feel that you have to reinvent the wheel. There's a lot of resource out there already that CPE kindly have done, including the initial briefing. So it's almost like a checklist. So you work through that and you can tick it as you go throughout it as well. The SOP, obviously, you'd need to make sure that you update your existing CPCS SOP, because obviously CPCS is going to be subsumed into Pharmacy First as well, and your SOP would need to reflect that as well. I think the final bit is just around what the LPC has been doing. So we currently have a number of stakeholder groups, including one with a regional, and when I say regional, there's one on an LLR basis and also on a Midlands level as well, where we used to talk about CPCS, and now we're looking at CPCS transition into Pharmacy First as well. So within that, there's a lot of activity around how we engage with ICBs, GP practices. Are they aware at PCN levels, and also even at LMC level as well? So we're working closely with the likes of Paul Gilbert, who's our community pharmacy clinical lead for ICB, and making sure that actually you guys have the information, and also not just about you guys being fit and ready, also making sure GP practices and reception staff and care navigators are aware of the changes, and they know how to be part of the service as well. So in terms of the PGDs and the signatories, I just wanted to go through this because I felt this was quite an important element, and it's something that I kind of overlooked until I sat down and did this slide deck a couple of days ago. So for a long time, we were given the draft PGDs, and quite recently the final PGDs have been published on the NHS website. And it's important that the draft versions are not signed. So please don't sign the draft versions of the PGD or protocols because they do not provide your authorization as an organisation to provide the supply. Just make sure that they really, tip and be vigilant. Make sure that you've printed off and signed the final PGDs on that note as well. So please, again, just have a look at that. I think that's all we need to say on that slide. And this is the link, and again, I'll circulate the slides following today's event. But we've recently just had the farmer outcomes screenshots being announced. So this is a really nice video that they've put together, which allows you to have a look at how Pharmacy First will look from a farmer outcome screen point of view. So it will show screenshot, slide by slide or screen by screen as you go through the process and what you'd actually see in reality when you go onto farmer outcomes as well. So that's just been released, and I wanted to share that with you as well. The other bit was just around updating Profile Manager and reiterating the importance to do that, not just for when you're delivering the service, but also at times when you're not delivering the service. For example, if you've got a locum, or hopefully your locums are registered to provide the service, but if on the odd occasion they're not, then you just need to make sure that it's updated. And this has also been added to the website, onto the LPC website, but it gives you some useful information in terms of how often should your Profile Manager be updated, and there's useful links in terms of supporting you or your pharmacy team in terms of how to do that as well. So registering for a new service and deregistering if you're not providing that service as well, and making sure that your Profile Manager is up to date in terms of the information that's there. So I just really wanted to quickly walk through, and I'm going through very quickly these slides around shortages and price concessions as well. So it seems to be becoming, more apparent that you guys are experiencing a lot of angst and a lot of issues when it comes to stock supply, but also around procuring meds at reasonable price to ensure that you're reimbursed. So obviously not within price concession. And funny enough, I was talking to a contractor today about a different drug as well. And I just wanted to reiterate that I am feeding these back to CPE, but it's really important that individual contractors also take the onus to actually report these issues on the CPE website, which again is linked. I've hyperlinked that aspect in there when trying to procure a medicine as well. So it's really important that you report that as an issue, as a price concession issue through the existing channel. The reason for that is if I do it, that's just one person doing it. But if you all do it, then it's obviously 224 of you doing it, which obviously will have a greater impact and influence in terms of numbers and feedback as well. So unfortunately, even though I'm chief officer, or fortunately, my voice is only counted as one when it comes to this process. So rest assured, I am continuing to feed back these issues to Janet and the team. Very recently, we've had some problems around Zetamib, also some melatonin as well. The brand version was the one I was looking at today, and it seems to be that the issue is getting worse. So although we've had some really good press around this week with regards to the ITV programme, that's not enough. We need to continue to use the tools that are already there for us to use so that we can escalate that as an issue back to CPE, and they in turn can raise that as a price concession request to DHSC as well. Okay. In terms of PQS, and this is just very quickly, we've got a number of tools available, but I feel that PQS has probably kind of been overshadowed with everything else that's happening, including hypertension, contraception, Pharmacy First, and obviously the foundation training changes as well. But PQS is still happening, as you're all probably aware. You can start to get your information ready, and the window opens on the 5th of February. So just a little polite reminder, please do continue to look at our deadline tracker, which contains some useful information of what deadlines are approaching for each of those months. And also just some useful links in terms of great gateway criterions and what you need to do for each of those domains as well via the drug tariff BSA website as well. So again, the gateway opens from the 5th of February, which allows you to obviously enter and declare for that period as well. And the deadline, funny enough, is also 1st of March as well, same as foundation training. So there's going to be a flurry of activity, I can already see. And very quickly, I know Paul's not here today, but you may have, again, I got a couple of phone calls from contractors this week when the email went out around the appointment booking pilot with Pfizer and ICB. So this is something that the South and Stat have been working on for probably over a year, which is a pilot specifically for LLR pharmacies to get involved in. And what it is in essence is an online platform which allows pharmacies to book in for services, but actually it's not the pharmacy that's booking them in, it's GP practices. So if a GP practice, if you are able to open your calendar, make available, depending on who's in and what availability you have, appointments in the morning, but you have got no one to do any services in the afternoon, that is automatically linked to a web browser to GP practice. They can obviously view that and they can book in appointments or whatever in terms of hypertension, contraception, the list can go on and on and on. So we're working in collaboration with Pfizer. The EOI submission deadline is today. So if you've not seen that, let me know, or get in touch with Paul Gilbert and just let him know that you and your pharmacy are interested in doing that, but do let him know by close of play today. So really quickly, just around the ADHD LPT setup. So again, this is the local agreement. I know it was getting a bit clunky to begin with, but it seems to have died down. I feel that most most of our LLR pharmacies are au fait with this. Again, we're the only region that have developed this initiative. So we've worked really well with LPT to make sure that you guys are able to procure stock through their WDA and take advantage of that to a certain degree as well. So there's a process in terms of that, and just to reiterate, LPT are supplying that a drug tariff. There's no inflated fee that they're making in terms of a profit. Just want to make that really, really clear. They're passing pound for pound on. I am speaking with Anthony Oxley, Chief Pharmacist for LPT. I would speak to him every week, but I am speaking to him around provision of potentially phasing this out. And that's a really difficult thing to do because, as you know, there's a list of a number of ADHD drugs that intermittently come in and out. So it's not just a linear, let's terminate and everything's back to normal. We need to make sure that our pharmacies are obviously able to procure stock, and patients aren't going to be initiated and then not able to obtain their prescriptions as well. So it's something that we started to give consideration to, but like I said, it's a non-linear conversation. So I'll give you more details on that, but I just wanted to let you know that those conversations have started to take place as well. And I think that's it. So, my contact details are there. Feel free to, contact me if you've not previously done so, or if you need to be part of our mailing list, encourage you or anyone that you know that should be part of our mailing list to contact me and the team as well. So, any questions, guys? Back to you. I'm just going to have a look in the chat as well, and I'll stop sharing my screen. Rahul, do you want to come in while I stop sharing?
Hi, sorry, I've got a couple of questions. First one's for Zinat, actually. With regards to Oriel application and for the contractors, I'm just a bit wary that a lot of contractors haven't actually used Oriel before. And the problem is that this is the only platform we'll have to actually showcase how good or what facilities our farm have. Now, do you have like a template gold standard advert? Because what I'm just wary that a lot of contractors, because of the shortage of time, they'll just put one line answers into those slots, and then when students are actually looking at the pharmacies, they're just going to brush past it because it would feel as if the pharmacist contractor hasn't put enough effort into showcasing that pharmacy. So do you have like a gold standard template that we could follow, or we could say, okay, fine, we understand we need to do at least 500 words or 1,000 words just to demonstrate what the actual program within the pharmacy is?
Yeah, so we don't necessarily have an example of what the perfect one looks like, if that makes sense. But what we do have is within the employer handbook, there is almost like a little guide on what you should put in. So actually, what makes a place more attractive versus what makes it less attractive. I know as part of the data cleansing process last year, where we had a insufficient program description, where it looked as though it's not enough information, we actually got in touch with those employers after the deadline and basically said, we're concerned that your program isn't looking attractive enough. Could you maybe add a bit more information about this or about that? So I would say the first bet is look at the employer handbook and use that to support you while you fill in the program description. And yeah, go from there. I hope that helps.
They give a certificate on your record, isn't it?
Thanks, Rahul. Was there a follow-up
Okay.
to that, Rahul?
Yes, there's my second question was with regards to what you just mentioned about LPT and that entire process. I understand LPT don't charge a handling fee, but can we as contractors actually claim out-of-pocket expenses?
Yes,
Because it
you
takes
can.
out. Okay.
Yeah, you can. You can. So that's been clarified previously. You can. So,
Yeah.
for example, I think taxis was an issue for some contractors not being able to make the collection. So you can, because I can't remember the exact precise wording, but it has been circulated in several emails as part of the setup that I did as well. So yes, in short, the answer is yes, you can.
Thank you.
No problem.
And my last question, it's more a contractor-based question in the sense that, correct me if I'm wrong, is it April this year when the new contract in theory should be coming out?
We've got no specific deadline, no specific, but yeah, we would expect. But I haven't got any updates. That would come from the CPU.
Right.
We don't know where they are.
Because
Well,
I'm
we
just a
get
bit
the updates
wary.
from the news. Yeah.
I'm just a bit wary because at the moment everyone's just focusing on pharmacy first and everything else, which is crucial at this stage. But we're going to get closer to the time the new contract going to be announced, and we don't even know what the bare bones of that contract looks like at the moment, and that's going to potentially determine our livelihoods for the next 5 years.
Yeah, it is. But if you have a look on the CPU website, to be fair to Janet and the team, they do provide updates with regards to negotiations, don't they? So it's just a question of having a look at where they are. But so they do provide updates, and they obviously do want to engage with contractors. Hence why they ask for contractor views as well prior to some of those meetings that they've had previously as well. And I think they've just asked for another one recently for owners to feedback. But I don't think CP have set a specific deadline to say by the 1st of March it will be out and we'll be in a better place. I think and I don't mean to sound like Janet, but it's a negotiation. So if what they put on the table isn't right, then I would hope that Janet and the team would push back as well. So I think it's about getting the right negotiation. But again, I'm not sitting on a negotiation team at all. I would just hope that that's how it is. Rahul, I don't have any further information on that.
No, that's great. Thank you.
No problem. Nadia, did you have your hand up as well? I think somebody else had their hand up. I don't know if it's Nadia.
I did have my hand up. I was going to ask, probably directed at Zinat, regarding the DS and the DPP. That isn't at the forefront of my mind right now. 1st of March is. Would there be an opportunity to have another webinar perhaps to dissect those two roles apart? Because for myself, I'm a IP, so if I could have the opportunity to be the DPP, that would make 25-26 a lot simpler. But I don't really know if I'm going to hit the criteria, or is your notes on the website so robust that I won't need to speak to you ever again, Zinat?
Hopefully, no, I'm kidding. So happy to set something up. So, if there is a demand for something post-March where we look into training sites more, DPPs, DSs, then by all means let Rajeshri know, and then between me and her, we can hopefully put something on and we'll have a bit more time. This one was a bit sort of like we needed to get something in quite early, and I know you've got a few things scheduled over the next couple of months. There is a person specification that's linked in my presentation for a DS and a DPP. And I can by all means go through that with you, but ultimately it's a self-assessment against that person's spec to determine whether or not you meet that. So if you're questioning, actually, can I be a DPP for a foundation trainee, your starting point would be look at that person's spec and self-assess yourself against it and be like, actually, am I meeting these requirements? Because ultimately that is going to be the process in which a DPP is decided. There's no process outside of that. It is looking at that person's spec and doing a self-assessment.
And is there an opportunity to pull from Oriel post the first, considering that there's so many changes, and if I was going to organise an external DPP, reliability, this is very new for us in community.
No, I appreciate
so
that.
There's how many, with good intentions, 1st of March, it's like you said, 18 months away.
Yeah. So when you say pull from Oriel, do you mean remove your program from Oriel?
Because you've scared me, yes.
Don't say that. I don't want to scare anybody. So what we can do is we can reduce the number of places to 0. So your program will still be visible, but you won't be offering any places, if that makes sense. So it doesn't mean once the program's on Oriel, like there's absolutely no circumstances to remove it. What I would say is try and only put a program in if in good faith you think you will be able to meet all of the requirements, because ultimately, especially the later on it gets in that process, a trainee might end up getting matched, and if that program gets pulled due to unforeseen circumstances, that's a sort of displaced trainee, and then they don't have a place, and then they're stressed and you're stressed, etc. So try and sort of put it on, and with the intention that you are going to be able to hopefully secure a DPP and a DS, etc.
Thanks, Bea. Nadia, does that answer your question? Not answer your question, but does that appease you in a way? I guess it's probably the.
Well, you don't want to mess people around in the first place. Obviously, I have every intention.
Yeah.
Then if I read all the paperwork and then I think in too deep or this isn't worried, but I'm sure it will be fine. I think it's a question that other people are thinking about as well.
One thing that
what I'm hearing is put my application in. I can if the world ends between, then I can pull back. But if I haven't got an application in, so I guess I'm just saying or encouraging contractors to go for it.
Yeah, no, I don't disagree. And I know the time is tight, but where possible, if you can set up or have a provisional agreement to have a multi-sector rotation with someone like a GP practice, that would be hugely beneficial in terms of you'll have access to a DPP, it'll make your program more attractive, and I'm not sure how much the extent to which this was emphasized when Yusra was doing the presentation, but from 26, 27, so not this 25, 26 year, but from the year after, multi-sector rotations of at least 13 weeks will be mandatory for all programs. So if you can get a setup for that first year, you've kind of sort of set yourself up with making it easy on subsequent years, because you've got a bit of a partnership set up, if that makes sense, for that 13-week rotation. And it also gives you access to that DPP, etc.
And just on that note as well, because that probably scared Nadia and probably other people, contractors as well, about no, don't be. It's what it is. But just on that rotation, it is something that we're aware of and something that the LPC has been speaking to but also the workforce faculty group, pharmacy workforce faculty group, which again is looking at it from a system-wide level as well. So we sit there with Claire Elwood, who chairs it. She's the chief pharmacist for ICB now, as well as Paul and other Anthony, like from LPC, etc. And we all have the same concerns, because we're all thinking, how on earth are we going to get these rotations in place when we haven't got those relationships? And also from a community pharmacist perspective, I guess the worry or the concern that I have for our contractors is that we're all going to be competing for same surgeries to take on our students as well, when it's not a linear, I keep talking about linear, it's not like one pharmacy to one practice. We're not in that world. It tends to be 6 or 7 pharmacies to that one practice, and if there's 3 or 4 of you that have got the students and wanting to do a cross-sector rotation, then and you're all trying to compete, and then the GP practice is obviously going to be very overwhelmed. It makes it very tricky. So we're thinking that we're looking at a system-wide approach in terms of how can we work better from an architecture point of view, not just with GP practice, but also the rest of the system, so that we all kind of take our fair share and help community pharmacy specifically on that as well.
One thing that's come out quite recently is that GP practices can be host organizations themselves. So previously they weren't able to, but now they can be. But similar to the position that you guys are in, they also need to set up a rotation because they need to ensure that the trainee has access to a dispensing site, and a GP dispensing practice doesn't count. So there may be some kind of reciprocal agreement as well, where, for example, their trainee rotates to your site for 13 weeks so that they get access to that dispensing environment, and vice versa with your trainee going to them. So we are trying to engage primary care more so that they understand that actually, yes, they love taking pharmacists and having them work for their practices, but now the effort needs to be put in to help develop that workforce and put that effort into training them as well, so that we're not dealing with a shortfall of pharmacists going forward. So we are working on that.
Thank you, Zee. Rahul, did you want to come in? Put your hand up.
Yes, sorry, it was just a follow-up to Nadia's question as well. I was just wondering, for example, if I find a DPP who works in another community pharmacy setting, but that pharmacy isn't actually a training site for pre-regs, is that okay or not? Because it's a DPPE and I'm sending my trainee over there, but if they're not registered as a training site, can they still be a DPP?
So my initial response to this is yes, but I will double check that. There is a sort of question about the training site requirements and actually if they'll stay the same as they do now because of us taking on that statutory education body role, and actually will it being classed as a training site be the same as it is, like as it currently stands, basically. So I personally think yes, as long as they meet the appropriate requirements of being a DPP, I can't anticipate that would be an issue. Because at the moment, for example, you're able to rotate into a GP practice, which isn't classed as a training site either, but that's fine. There is this link, which I'll share in the chat, which specifically gives information about the training site requirements for 25-26. And hopefully that kind of adds some further clarity, but I'll double check that one because that's a bit of an interesting question. And if the answer is no, then I'll get back to you and I'll ask Rajshri to communicate that to you, Rahul. But if the answer is yes, then I would say yes for the time being, unless you hear otherwise from me.
Thank you.
Thanks, Zee. Thank you, Rahul. Any other questions for anyone, really? Any questions for Zee or Yusra or myself? Any comments? No? Okay, well, it's 10 minutes past 9. I want to say thank you for joining us today. I think it's been actually a very fruitful discussion on the training programme and the foundation year as well. Just want to say thank you to Zee and Yusra for joining us as well. Genuinely appreciate your time. And if our contractors, if you guys want to feed back to myself, if you feel that there's if there's a need to follow up with Zee and the team and Yusra to join us again for a dedicated webinar on this, or to look at specific issues like Nadia's just mentioned about DPP and etc., then do let us know, because we can do that, but we need to know quite quickly so we can coordinate and get that up and running and set up really. So if you have any specific requests, please do let us know and I can confer with Zee. Is that okay with everyone? Bless you. Is that okay with everyone? Yeah.
Thank you, and thank you for having us, Rajshri.
No, welcome. Brilliant. Thanks, everyone. Have a lovely evening and thanks for joining.